40% of patients suffer noticeable and sometimes lethal side effects when they take a prescribed drug. The problem about side effects is rarely discussed. Doctors don't like to talk about it, but you can judge how big a problem it is by the fact that if there are 6 patients in a hospital ward, all side by side, one of them will probably be there because they've been made ill by a doctor, usually by a prescription drug that they've taken. Sadly, medicine's now one of the 3 big killers in our society, up there with cancer and circulatory disease problems such as heart disease and stroke. Here's a story about drug side effects. It involves a reader of mine, and there's a lesson at the end of it. My reader, an elderly man, went to his local surgery complaining of breathlessness. A nurse gave him a spirometer to blow into, a small, simple instrument which measures lung function. My reader huffed and puffed, but he was in his 80s and he couldn't do much with the little machine. On the basis of this single test, the nurse, who was running the surgery that day, diagnosed a wonderful new disease called chronic obstructive pulmonary disease, COPD. It's a ragbag diagnosis used to pull together a whole range of respiratory problems. Making this diagnosis was a pretty daft and dangerous thing to do. If my patient had put his hands around the nurse's throat, she wouldn't have been able to breathe very easily, but it wouldn't have meant that she had chronic obstructive pulmonary disease. "You have a chronic cough and you cough up sputum every day, don't you?" said the nurse. "No," said the man. "Oh, well, never mind," said the nurse. "I'll put you down as suffering from chronic obstructive pulmonary disease anyway." My reader had no other symptoms of COPD. His medical history didn't suggest that he was a likely candidate. He was, as it turned out, much later, breathless because he had a kyphosis, which meant it was difficult for him to get air into his lungs. But satisfied with her diagnosis, the nurse then exercised her newly acquired right to prescribe and prescribed a steroid spray. Steroids are, of course, extremely powerful and equally dangerous. They should only really be prescribed when absolutely essential. Since my reader didn't have COPD, the spray didn't work, it didn't do anything. So the nurse, a few days later, gave him a spray containing both a steroid and another chemical. Since the original diagnosis was wrong, this didn't work either. My reader then went back to see the nurse. Maybe the doctors were just generally too busy attending meetings or filling in forms, but anyway, he went back to see a nurse again and told her that the new medicine she'd prescribed still wasn't working. He trustingly asked if he should double the dose. The nurse, seemingly as ignorant as the old gentleman, duly doubled the dose he was taking. He then went back to see her another few days later, having developed atrial fibrillation, a known side effect of the fairly deadly mixture he'd been given for a wrong diagnosis. At that point, the doctor found a gap between all his meetings, put down his pen and stopped signing forms, and prescribed digoxin to control the atrial fibrillation. It didn't occur to the doctor to stop the drug that was causing the fibrillation, because he probably didn't know that the drug could cause fibrillation. Unfortunately, the digoxin slowed my reader's heartbeat so much that he started getting chest pains. So the doctor, probably fearing that the digoxin might slow the circulation too much, create a blood clot and cause a heart attack, started my reader on warfarin, a blood clotting agent. My reader's breathing problem was still no better, so he then had an X-ray, which showed that he had a kyphosis and that he also had a fall, which had resulted in a damaged couple of ribs. My reader was, however, now taking steroids, digoxin and warfarin, 3 of the most potent goodies in the drugs business, and was considerably worse than he'd been when he first visited the nurse. Naturally, the doctors involved refused to accept that the drug he'd been given could possibly have caused the atrial fibrillation. They claimed that the fibrillation had started soon after the drug had been prescribed, merely by coincidence. In truth, no one could say whether or not the drug had caused the heart problem, but since the drug company admitted that their product could cause atrial fibrillation, it seemed that to dismiss the possibility of the link was somewhat silly, rather akin to arguing that if a man had been hit on the head with a hammer and then developed a headache, there was no connection between the two. Or if a man had a broken arm after falling downstairs, the break was merely a coincidence. Doctors who've prescribed drugs which cause serious side effects rarely admit that there could be a link between the drug they've prescribed and a worsening of the patient's condition. Eventually, the elderly gentleman who'd had trouble breathing saw another doctor who took him off all the medicine he was taking, and it took a little while to do that because withdrawing these things can be difficult. By then, his ribs were better, and some exercises were done which helped to relieve the kyphosis a little, and the breathing became a lot easier. The problem disappeared. The problem here and the message is that doctors prefer almost any solution than the awful one that a patient has been made ill by a side effect, because that means that it's their fault. And doctors don't like admitting to having made a mistake because of the moral and legal overtones. And so, here's the message. Coleman's first law of medicine, there are 12 of them altogether, but this is the first, is that if you're receiving treatment for an existing disease and you develop new symptoms, then, unless proved otherwise, you should assume that the new symptoms are caused by the treatment that you're receiving for the old ones. My name is Vernon Coleman. Please ask everyone to watch the videos on this website. Thanks for watching An Old Man in a Chair, and thanks for all your support. I've not authorized any adverts or any sponsorship on this video. My website, www.vernoncoleman.com, has all sorts of articles on a wide range of topics, but there are no ads or sponsorship there either. If you want to see more videos from me, please subscribe to the channel because my videos are not always easy to find. And let's spread all the truths as widely as we can. Thank you for watching.